Welcome back. In this video we'll talk about the complications occurring in twins pregnancy. If the ultrasound image shows two placentae, there are two infants, even if you don't see the other one. The most common presentation is monochorionic diamniotic, which means two infants sharing the same placenta and therefore identical twins, but each is living in their own amniotic sac. So monochorionic, which means one placenta, diamniotic, which means two amniotic sacs. The other scenarios we have are dichorionic diamniotic and monochorionic monoamniotic. Of course, conjoined twins will also be monochorionic monoamniotic. The most common complication in twins pregnancy is preterm labor. This should be anticipated by putting the patient in the hospital when they reach 33 or 34 weeks of gestation. But you should also look for hyperemesis gravidum, because a growing fetus will secrete beta-HCG, and this induces vomiting, and that's why they feel sick. And when you have two feti growing at the same time, you'll have even more beta-HCG and more feeling sick. This commonly causes dehydration that is severe enough to cause the patient to be admitted. Also look for preeclampsia, which you can monitor using urine proteins and blood pressure, gestational diabetes, intrauterine growth restriction, anemia, and of course malpresentations. These are the most common complications. We have some rare but rather interesting complications, like twin-twin transfusion syndrome. We see it in monochorionic twins, in which one fetus will be a donor and the other will be the recipient. There will be a blood vessel connecting the circulatory system from the donor into the recipient. And so the donor will have less blood in their system, and they will be much thinner, and the recipient will be overloaded with blood. This obviously creates problems in both twins. And here's a small quiz to test your understanding of these premises. In which of the following pregnancies do we see entangled cords? And the answer is monochorionic monoamniotic. Alright guys, that's all I have. Thank you so much for watching, and hopefully this helps.